Cancer treatment is a continually evolving area of medicine. Advancements, such as Elekta's treatment technologies and software, mean more options and better outcomes for patients everywhere. Cancer is a group of over 100 diseases characterized by abnormal, uncontrolled cell growth. In a healthy body, cells are replaced in a very controlled way. Damage or change in the genetic material of cells, by environmental or internal factors, sometimes results in cells that continue to multiply until a mass of cells, or a tumor, develops.
A cancer cell will grow out of control in that part of your body, but also acquires the ability to travel in your bloodstream or your lymphatic tissue.
The goal of cancer treatment is to destroy cancer cells with as little damage to the surrounding normal, healthy cells as possible. Depending on your type of cancer, doctors use a variety of treatments, including advanced radiation therapy treatments and chemotherapy to destroy cancer cells. And surgery, which physically removes tumors from the body. New research and innovations have completely changed the experience of cancer treatment. In support of traditional treatment methods, patients may be offered innovative medical therapies or personalized treatment environments that can adjust audio, visual, and temperature settings to individual preferences. Advanced electronic medical record systems, such as Mosaic, enable your medical teams to seamlessly share information and coordinate all aspects of your comprehensive treatment plan. After viewing the following introductions to radiation therapy and chemotherapy, you may wish to make a list of questions to bring to your next appointment. Being informed will help you and your medical team work towards a successful outcome. Radiation therapy is one of the safest, most effective tools in cancer treatment today. It may be used to reduce the size of a tumor before surgery, or to destroy any remaining cancer cells after surgery. It may also be used as your primary treatment course, or in conjunction with chemotherapy.
There are two different types of radiation. One where the radiation source is actually placed within the patient next to the tumor or in a cavity where a tumor once was. That is referred to as brachytherapy. Alternatively, radiation can be delivered from the outside or from a linear accelerator or machine. That is referred to as teletherapy.
Teletherapy uses high-energy radiation beams precisely directed at your cancer cells to maximize treatment effectiveness with minimum damage to normal tissues.
Most commonly, patients are treated once a day, 5 days a week for anywhere from 2 to 9 weeks.
Some highly specialized techniques use higher doses of radiation delivered in a more targeted fashion over fewer treatments, minimizing the severity of side effects even further. Your radiation treatment process consists of 4 basic steps: simulation, planning, preparation, and treatment.
After a patient is consulted by the doctor, they'll come in for what we call a simulation. And that's where we position the patient and they do a CT scan where they're able to localize the tumor.
Your radiation therapist uses reference markers and immobilization devices to make sure you're positioned for the best angle of treatment. The CT scan obtains a high-resolution 3D image of the anatomical region to be treated. These images will be used in the planning phase. After your simulation appointment, your medical physicist and dosimetrist work closely with your radiation oncologist using advanced computer software to plan the sequence of radiation beams and calibrate the radiation dose. Using Mosaic software, your treatment team can manage dosage calculations and administration with built-in safeguards that support safe and accurate treatments. This complex planning process may take several days before you will return for your first treatment appointment. Before each treatment session, another set of images is taken to compare with the initial scan. This step helps verify that every detail is correct before beginning your radiation treatment. Once preparation is complete, treatment begins.
The new Elekta equipment is extremely accurate. You're diminishing a lot of the side effects that we had years ago because you don't have to blast a lot of the area that might be right next to the tumor that you're treating.
During radiation, you can easily communicate with your treatment team.
We have an intercom system, so we could hear you. We're watching you the whole time on a closed-circuit TV. If you need to say something to us, we can hear you and speak back.
They always made sure I was comfortable. I worked through my entire radiation treatment. I never felt the fatigue, and I literally jumped right out of my radiation treatment. I went right to the gym afterwards.
The actual time the beam is on, delivering radiation, adds up to less than a few minutes. However, you may be in the treatment room anywhere from 10 to 40 minutes, depending on the complexity of your treatment and preparation.
So we've got image-guided radiation therapy. We're actually taking images both before and during treatment to ensure that the position of the patient is right on, as well as we can see the tumor and how it's changing from one fraction of treatment to the next.
With multiple built-in equipment and software safeguards, radiation therapy is used to treat hundreds of thousands of patients safely each year. Chemotherapy is a treatment that delivers powerful drugs throughout the body to stop or slow the spread of cancer. Unlike radiation therapy, which targets specific cancer cells, chemotherapy drugs circulate throughout the entire body to destroy cancer cells.
Cure is our ultimate goal, and chemotherapy sometimes is the only way to achieve that. But chemotherapy has other places that it works. It can relieve side effects. It can extend life.
Most chemotherapy drugs are administered directly into your bloodstream through an IV, although some types of medications may be given by injection or ingested orally. Your medical oncologist prescribes medications based on the specifics of your cancer, your treatment goals, and your medical history. Using dedicated software known as Mosaic, your oncologist can manage dosage calculations and administration with built-in safeguards that support accuracies and guard against potential drug interactions or patient-specific allergic reactions.
I can go on the computer and check exactly where a patient is in their treatment. It takes the pressure off the patient. They don't have to worry about remembering every little detail that might be important from one doctor to the next. It gives them a sense that we're all working as a team.
Other members of your treatment team include the pathologist, who oversees your lab tests and reports results back to your medical oncologist, and your oncology nurse, who coordinates your care and helps you manage your side effects.
Chemotherapy kills other cells in our body that reproduce quickly. Your hair follicles, your blood cells, and your reproductive cells. So unfortunately, those cells are killed as well, and that's where almost all of your chemotherapy side effects come from.
During periods of rest in between chemotherapy sessions, your body will rebuild healthy cells.
I just felt like cancer is doable, cancer is containable. I want somebody to look at me and say, well, if she can do it, I can do it.
Chemotherapy is an incredibly effective and safe tool, and you can be confident that your entire treatment team will be working with you to make your course of treatment as easy and comfortable as possible.